Welcome back to the OHSU Effect. I'm Lacey Evans. We're going to switch gears now and talk to Dr. Renee Edwards. She's a urogynecologist in the OHSU Center for Women's Health who specializes in the treatment of urinary incontinence and pelvic organ prolapse conditions using medical, surgical, and minimally invasive surgical techniques. She's also a fellow of the American Congress of Obstetrics and Gynecology and the American College of Surgeons. Good morning.
Good morning, Lacey.
Let's talk about urogynecology. Talk about your specialty.
Well, I'm excited to let you know that urogynecology is actually the newest medical subspecialty approved by the American Board of Medical Subspecialties. And with this designation actually comes a new name. Rather than being urogynecologists, we're now called female pelvic medicine and reconstructive surgeons. And this is an area of medicine that can be entered into either coming from a background in a urology residency or an OBGYN residency. And we follow on with 3 additional years of training and fellowship. And we actually evaluate and treat women who have urinary incontinence, who have non-cancerous other conditions of the bladder, such as urgency frequency syndromes or chronic urinary tract infections. We also see and evaluate women with pelvic organ prolapse and with disorders of defecation, fecal incontinence, issues like that.
Okay, well, let's stick with urinary incontinence. That's the topic of our interview today. It affects 30% of women. So what can cause it?
Well, we don't always know what causes urinary incontinence, but in truth, the most common reason is damage to the connective tissue, the muscles, and the nerves of the pelvic floor that then affect the functioning of the bladder. And for better or worse, the main insult that most women have to their pelvic floor is at the time of childbirth. Because although we all love our children and are thrilled to have them, we know that that can damage some structures of the pelvic floor. Now, there can be other causes of urinary incontinence, such as some neurologic disorders, such as strokes or Parkinson's disease, multiple sclerosis. There can also be reversible causes of incontinence, such as getting a urinary tract infection, which temporarily throws your bladder off kilter.
So are there different types of incontinence?
Absolutely. The most common by far, though, are stress urinary incontinence and urge urinary incontinence. Stress urinary incontinence is a kind of leakage that happens because of a cough or a sneeze or a bend or a lift. That's pressure on the pelvic floor. The other common type of urinary incontinence is called overactive bladder or urge incontinence. This is what happens when you get a sudden, strong, powerful urge to go to the bathroom and just know that you're not going to make it there on time. And that can also be associated actually with getting up at night to go to the bathroom.
How can this affect a woman's daily life?
Well, the main issue with urinary incontinence, it's a huge quality of life issue. We're all used to having control over things like our urinary continence. And if you're fearful of playing tennis or going to an aerobics course because you might leak, you might stop doing those activities. Or if you're fearful of getting a sudden, strong, powerful urge and not being able to make it to the bathroom on time, then particularly in elderly women, they may stop going out of the home. They may be fearful of going out in public because they never know when they're going to have an incontinence episode. So it can lead to a real feeling of loss of control, and actually depression can be associated with urinary incontinence because of that reduction in social activity or physical activity, or just not feeling like you're controlling things like you used to.
Well, let's talk about the different options for treatment.
Okay, so there are both conservative and surgical treatment for urinary incontinence, and the type of treatment does depend upon the type of incontinence that you have. Urge incontinence or overactive bladder can often be managed conservatively with simple maneuvers like looking at your fluid intake, some of your drinking habits, what time of day that you drink. Also Kegel exercises, those muscles that we do to strengthen the pelvic floor muscles, treat urgency in overactive bladder just as much as they also do stress incontinence. After that, overactive bladder is often managed with medication that's designed to relax the bladder muscle so that it's not spastic. And stress incontinence can be treated with the Kegel exercises, can be treated with a device called a pessary that's worn in the vagina to support the bladder, and can also be treated surgically.
Let's talk about how it's diagnosed.
often history alone, just talking about why you leak, can lead your care provider to understand what type of leakage you have. And conservative management can absolutely be embarked upon even just by listening to the patient, the story behind her leakage, and then, of course, doing a physical examination to understand how well the bladder's supported and if there's any issues of anatomy. After that, sometimes it does require specialized testing, and we call that urodynamics, where we put a thin, small catheter in the bladder. We'll fill the bladder with water to see how the bladder does with holding, have you cough and bear down to see if leakage occurs with those circumstances, and then have you go to the bathroom to make sure that the bladder is working appropriately to empty itself.
Where can women go to find more information about incontinence or making an appointment with you?
There are a few great resources. Obviously, they can go to the OHSU Center for Women's Health website, where the urogynecology group has a lot of information about incontinence and prolapse. Another excellent resource is the American Urogynecologic Society's website, and they also have a patient website that's called mypelvichealth.org.
Dr. Renee Edwards, thank you so much.
Thank you.